I could not agree more with this. There are so much worse things than dying, and I feel like unless you work in the healthcare setting, you don't really understand this. Like, don't get me wrong, death is sad. Death is hard. Like, valid. Very, very valid. Have you ever seen somebody or taken care of somebody that has a trach and a feeding tube and is like a GCS of 4 to 5 and has a stage 4 sacral wound on their bottom? That means that wound goes all the way down to the bone. I know that quality of life is different for everybody, and everybody has different beliefs, and like, I respect that. At a certain point, there is a time where we are doing things to people and not for people. That's why it's so important to either get your advanced directives done, like that's going to be the best option, or at minimum, talk with your trusted people in your life. At least 1 or 2 people that you know would respect what decisions you would want at the end of your life. Or should you be unable to make decisions for yourselves and they're presenting options to you, would they want to be on a ventilator? Would they want to be on one long term? Would they want a feeding tube? Would they want artificial tube feeding? Have these hard conversations with the loved ones in your life, because nobody wants to make these decisions, but it's better to make informed decisions and know that you're respecting the patient's wishes than to be put in a situation where you're like, ah. So anyways, yes, there are worse things than death. 100%. I agree with this, even though death still is very hard, very sad for a lot of people.